أشكر أهلي.
Being from each of handling it's the same they start equipment, or we called it PPE. The personal protective clothing, head covers, gloves, face shields, goggles, face mask, and N95 we are calling it, or protect injury or infection or illness. We have the PPEs, and the types of PPEs that we have: gloves, gowns, face mask or N95. We have the goggles or face shields, head cover, and shoe cover. So these are the PPEs. So it's up to the condition or in the situation where we can choose what appropriate PPE we will wear or we are going to use. So these are kinds of the PPEs that you can find in a healthcare. So we have the disposable hood, the disposable gowns, we have the mask, surgical mask, we have the medical mask, disposable shoes, we have the goggles, we have the gloves, and the face shields. Okay, so you can find it all in the healthcare facility. So number 3, for the standard precaution, we have safe injection practices. So what are safe injection practices for? They are intended to prevent transmission of infectious diseases between one patient and another, or between a patient and a dental healthcare personnel during preparation and injection of medications. So number 1, what do we do in this practice? We prepare injection using aseptic technique in a clear area. So we are preparing injections in a clean area. Secondly, we disinfect the rubber septum. There is a rubber on that vial, on a medication vial with alcohol before piercing it. Do not use needles or syringes for more than one patient. It includes manufactured pre-filled syringes and other devices such as insulin pens. Now you can see there is a photo here that says no to 2. To say, in some of those disposable needles, disposable gloves, all of those disposable, they have this logo on the label. What does it mean? It means only one use, single use only. So there is nothing like you have to repeat using this again. Okay, so this might cause infection. So that's why they put the label of no to two, single use only. Number 4, we have the safe handling of sharps and needles. Remember the following sharp safety rules. Do not recap needles or shear clips or bend needles. Do not recap. You don't recap it. When you open the syringe with a needle, don't scoop it. Don't put it back. Do not recap. Number 2 is do not refill sharps container. In the sharps container that you can see now, there is a level. Only 3 ports, not more than that. So whenever you have seen your container, which is 3/4 filled, you have to dispose it. And proper disposal, you have to close it, the red on top, and it will not be open. Okay? Ask the housekeeper to put it in a medical yellow bag and dispose it to the waste room. Sharps container should be at the eye level and within your reach. It should not be put down or it should not be in anywhere within the patient care area. It should be hung on the wall at a level that you can reach it, and it should be within eye level. Why? Because if pediatric patients will come around, they will be accidentally pricked. Or as you, the same thing, if you will just use it and it will just be, it will slip off. So there will be an accidental spill of sharps in the floor. Do not remove the sharps container top or remove the sharps from container. Do not put your hand into the sharps container, which is already used. You will be pricked. Okay, so these are the sharp safety rules. Number 5 is respiratory hygiene or the cup etiquette. They are terms that is used to describe infection prevention measure to decrease the transmission of respiratory illness. Example, the influenza, cold viruses. So they are being used to protect the people, opposite you or you yourself, you have to protect them. You have to protect yourselves. Respiratory hygiene is part of the standard precaution that should be taken to prevent the spread of disease. Number 1, cup your mouth, cover your mouth and nose when coughing or sneezing. Use tissues and throw them away. Wash your hands or use a hand sanitizer every time you touch your mouth or nose. Okay, so this is the respiratory hygiene or cup etiquette. Number 6 is patient care equipment. So when dealing with patient care equipment, healthcare workers should, number 1, handle equipment that might be contaminated with blood in a manner that prevents skin and mucous membrane exposures, contamination of clothing, and transfer of microorganisms to themselves, other patients, and surfaces. Number 2, we have to evaluate equipment and devices for potential cross-contamination of blood, especially those medical equipment that it's being used inside of operating room. So they also should establish procedures for the safe handling of such equipment during and after use, including cleaning, disinfecting, or sterilizing as indicated. Clean and disinfect the environment. Cleaning is necessary first step of any disinfection process. Before you disinfect any instruments or any medical equipment, it must be cleaned first. Okay, so cleaning removes organic matter, salts, and visible soils, all of which interfere with microbial inactivation. the physical action of scrubbing with detergents and surfactants and rinsing with water, it removes substantial numbers of microorganisms. So when cleaning, it removes substantial numbers of microorganisms. So it removes substantial, okay, in cleaning. In disinfection, it destroys most pathogenic and other microorganisms by physical or chemical means. So in cleaning, it kills substantial or it destroys substantial microorganisms. While disinfection, it destroys or kills most pathogenic microorganisms. In contrast, sterilization destroys all, all microorganisms, 100% all, including a substantial numbers of resistant bacterial spores by heat or by liquid chemical sterilants. So in sterilization, we are using steam autoclave, dry heat, and unsaturated chemical vapor or liquid chemical sterilants. Okay, so it is clear. By cleaning, we destroy substantial microorganisms. In disinfection, we destroy most pathogenic microorganism, and in sterilization, it destroys 100% all microorganism, including spores. Number 8, management of linen and laundry. The best practices for linen and laundry handling. Number 1 is always wear reusable rubber gloves before handling soiled linen. Whenever we make a bed, whenever we strip off the bed, so we need to wear gloves. So never carry soiled linen against your body. When you are stripping beds, never carry soiled linen against the body. Throw them up next to you. You have the uh, uh, dirty linen hamper. So throw it all immediately. Dispose it all immediately. Carefully roll up soiled linen to prevent contamination of the air, surfaces, and cleaning stuff. So these are the management of linen and laundry. Number 9, we have transmission-based precautions. What is a transmission-based precaution? They are the second tier or second level of basic infection control and are to be used in addition to standard precaution. For patients who may be infected or colonized with certain infectious agents for which additional precautions are needed to prevent infection transmission. So we are using it second to, in addition to standard precaution. We have 3 types of transmission-based precaution. Number 1, we have the contact precaution. Use contact precautions for patients with known or suspected infections that represent an increased risk for contact transmission. Okay, so contact precaution, those you have contact with. So these are the contact precaution. Droplet precaution is anything for patients known or suspected to be infected with pathogens transmitted by respiratory droplets that are generated by a patient who is coughing, sneezing, or talking. Okay, for the COVID-19, so what we are using for the COVID-19 now, it is transmitted by respiratory droplets. So it is droplet infection. Why we are using mask and why sometimes we are using our gloves. Number 3 is airborne precaution. Use airborne precaution for patients known or suspected to be infected with pathogens transmitted by the airborne route. Ano ba yung mga airborne route? Tuberculosis, measles, chickenpox, disseminated herpes zoster. They are coming from the air. So it is transmitted through the air. These are the posters that we during our transmission-based precaution signs. Okay, this is the example sign of a poster of a contact precaution. When a patient inside of that room is going to have a contact precaution, or if that patient is having a disease like gastrointestinal disease or something like diarrhea, so contact precaution is going to be at the door. We are posting it outside the door of the patients, okay? So everyone going in, they know what to do. Like if it is contact precaution, like let's say you stop, you wash your hands or you put the hand sanitizer and use the gloves and your protective disposable gown. Okay? So for contact precaution, the same, you have to hand hygiene. You have to use the appropriate gown and the appropriate gloves. Did you see here that the nurse is not wearing a mask? Why the nurse is not wearing a mask here? For the contact precaution, why?
The air. It is not.
Anyone could have the idea why? Why the nurse is not wearing a mask during the contact precaution?
It is not contact. It's not contained in the air.
Sorry.
It's not in the air, so she cannot. I mean, like the germs is not in the air, so there is no need for the mask. It's
okay.
not airborne.
Yes, you are right. Yeah. So because contact precaution is only it will be transmitted once you are in contact with. Just like if you touch the surface or if you touch the body fluid. When the patient is having diarrhea, she or he will have a infection through his stool or through his urine. So it is contact. So it doesn't need a mask for this. You only need a glove and a disposable gown. Droplet precaution. This is the example sign of a poster when you have the droplet precaution. Like when you have a patient with a COVID positive. So at the door of this COVID positive, it will have this sign of droplet precaution. So you have the same thing. You have to stop. You have to hand sanitize, wear mask, gown, or it depends whether you will use your gloves. So why it is not used the gloves here? Why the gloves is not being used in the droplet? Why it is only with a mask?
Because it can also only be transferred through air, so only
yes.
The mask is necessary.
Down on the surface.
Droplet is, this one is respiratory. Anything that drops, okay? So, I mean, airborne, as what you said, it is not airborne. This is a droplet. This is from the respiratory. Anything that comes like body fluid, like the sneezing, those secretions that comes from sneezing, coughing, so they are droplet. They can fall, okay?
Yes.
It will be transferred to you. So only the mask. COVID nowadays, because of this respiratory, with this running nose, cough, so they are using mask for this one. Okay, so gloves, if you have touched the surfaces, wherein this one has dropped, you know, when somebody is coughing and you are next to this surface and you have touched it, that means to say you will get infected, or the spread of infection is more probable. Okay, so you will be using gloves. Nowadays, most of the people here, they are using the gloves. Okay, is it appropriate or it is not appropriate?
It's appropriate, but also sometimes, ma'am, when you touch something, the people doesn't know how that there are, if the gloves is already infected, they continue to touch their face, or there is no more use.
Yes,
So
yes,
that's
you are right. You are right.
I think
As I
like
told you, there is a circular from Department of Health that is circular number, if I'm not mistaken, it is circular number 55 or 57 something, recognizing the use of PPE. So it was mentioned there when to use the PPE, when to use the gloves, when to use the mask, especially in this time of COVID pandemic. Because nowadays, most people are using gloves everywhere, anywhere. Is it proper? No. Because as you use the gloves, soon as you use it, it will not take more than around maybe 30 minutes to 1 hour that you are using a glove. As a standard, you have to remove the glove every after patient care. Okay? So why these people are using the gloves for 8 hours? And then they are touching their hair. They are touching their face. They are touching their mobiles and touching their bags and touching everything. So where is the standard precaution there? Okay, so let's have an education. We have to educate those people because they might only hear it from somebody else that you have to use gloves when touching, right? You have to use gloves. But it is not going to stay with you forever. It is there with you. How long? How many hours you are using your gloves? It is already infected. Okay? So use gloves accordingly, appropriately. Number 3 poster, we have the airborne precaution. In this airborne precaution, we sterilize, we hand rub, we sanitize. We have both the mask, and you see now, there is no gloves. It depends. Gloves can be used when touching surfaces, and gowns can be used if the patient is already infected. Okay? So airborne are those four that, bacteria that is coming on the air, through the air, or passes through, is spreading through the air. Okay? Like tuberculosis, like, what else we talk about, as in those airborne that comes through the air. Patient placement. So number 10 is to ensure appropriate patient placement. So in the hospital, in a big hospital, we have a patient placement coordinator. It is a nurse. She is a nurse. She is a patient placement coordinator in the admission office. Because what? She uses her diagnostic, or she uses patient's condition to find out where this patient is going to be placed. Like for example, if there are around 4 beds in one room or 2 beds in one room, so she knows what patient to be placed in there, what condition of the patient should be placed in there. Like for example, the patient are both tuberculosis. You cannot put 2 patients in that room. So it should be separated, isolated patients for those airborne patients. But if patients like, they are both having fever and they are both having surgically operated with appendicitis. So both of them can be placed in one room together. So this is the patient placement. So it is the responsibility of the patient placement coordinator to check whether these patients are going to be placed together or this patient is going to be placed somewhere else. So the patient will be assigned matching to the department of where this patient's condition should fit in and estimating a discharge date also. So she is a patient placement coordinator. Number 11, we have the waste management and disposal. Waste is defined as anything which is not intended for further use is termed as waste. Anything that is waste, anything that is not needed, it is already waste. So medical waste is any kind of waste that contains infectious material or material that's potentially infectious. Medical waste. Hospital waste, any waste which is generated in the diagnosis and treatment of human beings in a healthcare facility. That is called hospital waste. The waste management is the management of waste produced in a healthcare facility. So this is different terms for the waste management. We have two kinds of waste, of hospital waste. What are the classification according to the World Health Organization? We have two classifications of waste. Number one, we have the hazardous waste. Hazardous waste are waste with properties that are potentially harmful to human health and to environment. They are potentially infectious. They are potentially harmful. So non-hazardous are waste that does not cause harm to human being and to environment. So we have we have two types of waste that has been categorized by, classified by the World Health Organization. Number one, medical waste. These are the types of hazardous waste. So infectious medical waste are waste contaminated with blood and other body fluids. So they are cultures and stocks of infectious agents from lab, from waste from patients in isolation wards, and equipment and bandages. And any material having been in contact with infected patient. So in general, anything that has contact with patients is considered as infectious medical waste. So cultures, waste from surgery and autopsies of dead bodies. Pathological waste. Pathological waste are the waste that originates from tissues or samples of tissues that are in the lab. So they are human tissues. They are body parts. They are organs. They are fetuses, blood and body fluids. Number 3, we have sharps. Sharps are objects having an edge or point that is able to cut or pierce something. What are those sharps? They are needles, syringes, scalpels, infusion sets, sword knives, surgical blades, broken glasses, any other items that can pierce the skin or cut or puncture. Number 4, we have pharmaceutical waste. Pharmaceutical is defined as any chemical or biological product, medicine that is intended for use in the diagnosis, cure, mitigation, care, treatment, or prevention of disease or injury of a human. So expired unused pharmaceutical products, spilled or contaminated pharmaceutical products, surplus drugs, expired vaccines or serums, discarded items used in handling pharmaceuticals. For example, the bottles, the gloves, masks, tubes, so they are all put and disposed in the pharmaceutical waste. We have number 5, genotoxic waste. They are waste that may have mutagenic, teratogenic, or carcinogenic properties. What does it mean? Mutagenic, it mutates, it duplicates. Teratogenic are those drugs that has been used by those mothers when they are pregnant. Carcinogenic, those medicines or
Okay.
drugs that has been used by patients undergoing chemotherapy or radiotherapy. So they are cytotoxic drugs, outdated or expired drugs, vomiting, feces, or urine from patients treated with cystotoxic drugs, chemicals, and radioactive materials. We have also the chemical waste. Where are these chemical waste coming from? They are disinfectants. They are solvents, reagents from lab. They are batteries, heavy metals that contains mercury from broken thermometer and from broken blood pressure apparatus. Those chemicals from diagnostic and experiment work, cleaning processes like detergents, disinfectants, housekeeping and disinfecting procedure, mercury waste, such as broken clinical equipment spillage, cadmium waste mainly from discarded batteries. All of this, it goes with the chemical waste. Radioactive waste. These waste include liquid, solid, or gaseous waste contaminated with radionuclides generated from in vitro outside, analysis of body tissue, fluid, or in vivo body organ imaging, and tumor localizations, and investigations and therapeutic procedures. It can also consist of any glassware or other containers contaminated with radioactive liquids. Those radioactive means to say those patients under the radiotherapy, those pampers that the patients are using, all of those are going to be disposed in a radioactive waste. Did you see that we have the logo of the radioactive? So when we see this logo here, it means it's very dangerous. It's very, poisonous, it's very dangerous, it's very risky, all of the above. Okay, so it's radioactive waste. Talking about the non-hazardous waste. General waste are non-hazardous waste and they are no risk to human health. So means to say, those office supplies that we are using in our offices, our paper wrappers from the kitchen waste, general sweeping waste, all of these are just domestic or general waste. Number 12, in the standard precaution, notification of communicable disease. All communicable and infectious diseases are to be reported to the health authority and or preventive medicine Abu Dhabi. As we said, it is the responsibility of the infection control nurse to report, to notify infectious communicable disease to health authority, to local authority. Number 13, it's immunization and vaccination. Why do we need vaccination, immunization? Vaccination is the most effective tool for controlling and eliminating serious infectious diseases, preserving public health and protecting lives, and Department of Health's vaccination is essential campaign brings attention to these facts. Like for example, as I told you, during the time of flu, so influenza. So in the endemic of influenza, the government from the Department of Health, they are providing vaccines of flu shots for all the residents of Abu Dhabi. As long as your visa is within Abu Dhabi, so you will be able to avail the vaccination of the flu shots. Okay? So vaccination is when a vaccine is administered to you, usually by injection. And immunization, it is what happens to your body after you have the vaccination. And the vaccine stimulates your immune system so that it can recognize the disease and protect you from future infection. You become more immune to that infection. Like if this COVID, we are going to have the COVID vaccine, so we will be in the future, we will be protected. We will be protected from COVID infection. Sterilization of medical and dental instruments and equipments. When we say sterilization, it is the use of physical or chemical procedure to destroy all microorganisms, including substantial numbers of resistant bacterial spores. It is also refers to killing or removing of all viable microorganisms. Again, sterilization refers to killing or removing of 100% of all microorganisms, including spores. The aim of sterilization is to break the chain of potential cross-infection between individual patients by killing microorganisms, including spores. Sterilization using a steam sterilizer, or we are calling it autoclave. You will find it only in the Central Sterile Supply Division of the hospital. So it is using, sterilization is using a steam sterilizer or autoclave, and it is recommended to the most efficient, cost-effective, and safe methods of sterilizing dental instruments, especially in primary care dental practices. Sterile means free from all living microorganisms. This is how the steam sterilizer or autoclave machines are